So I'm here today with the fabulous Anita Mitra. You've got to tell us off the bat, what does your surname mean?
So it's the Greek word for uterus.
I didn't write that, honestly, it's true. And we just wanted to talk about periods from a kind of slightly more medical perspective, and to hopefully give you some facts and home truths, because Anita is a gynecologist, and also to give you some kind of tips and information that you can really, hopefully will make you feel a bit more relaxed, or in some cases will prompt you to go and take positive action to improve your health situation with regards to periods. So first and foremost, just tell us a little bit about yourself in terms of your gynecological work and what your kind of interaction has been with periods so far.
Sure, okay, so as you mentioned, I'm a gynecologist, but actually before I was a gynecologist, I was a scientist.
Right.
So I have quite a good appreciation of the scientific evidence behind why we do what we do with patients. But now, basically, my job is to talk to people pretty much all day, every day about periods.
Right.
So
me too.
There's not really a story that I haven't heard about periods.
Right.
And I find that a lot of people come, they feel very anxious, very nervous, very embarrassed to talk about periods. And so I really like to try and make them feel at ease. And because of that, I think I've probably heard a lot of stories that many people have never felt that they're able to tell their doctor, or questions that they're able to ask. And I think that that's something that's really important, because I think there is a lot of mystery surrounding periods, mainly because the information isn't out there in a digestible or reliable form, and people don't talk to their friends or family, and so they don't really know what's normal. So I think it causes quite a lot of anxiety, actually, and so that's why I started sort of speaking out on social media, on blogs, and working with other bloggers and influencers to try and sort of get the word out there that it is okay to talk about your period.
Hashtag screw the taboo, which is completely one of our main missions.
Definitely.
Because the more you talk, the more all the old wives' tales are obliterated. People have actual information they can trust, and then they can make their own decisions on how they want to manage their periods, whether it's through tampons and sanitary towels, or moon cups, or reusable pads, or whatever it may be. Whatever works for them is going to be the right way to go for that person, rather than what their mum has always what their mum has always done, or what their sister tells them is the best thing to do, or their best friend, or whatever it is. I mean, I remember giving a talk to sixth form girls at a comprehensive school in Hackney, and some of them were saying, well, I don't use tampons because I heard that the string always falls off and it can get stuck inside you and things like that. Now, that might have happened occasionally, but obviously that's not a frequent occurring event, and certainly shouldn't be a reason for someone not to try tampons, for example. So there are lots of kind of weird stories, or people say they're facts but they're not facts, out there about all kinds of sanitary products.
Yeah, and I think there are a lot of kind of like urban legends, and everyone likes a shock or a horror story, don't they? And those kind of things tend to spread more than just kind of maybe the more mundane kind of reliable pieces of information that are quite necessary for all women to learn about.
Do you find that there's a particular issue that repeatedly comes up with the women that you're talking to that is a real concern or worry?
I think, to be honest with you, I think one of the biggest problems is that people don't really understand what's normal.
Yeah.
And it is difficult, because I don't really think there is one true normal. I think it really varies from person to person.
Yeah.
But people are just kind of afraid to speak up, because they think, oh, someone will think that I'm stupid for not realising that this is what happens.
Yeah.
And so, I think understanding normality is one of the biggest problems. And then off the back of that comes the problem of people not actually seeking help when something is really abnormal.
Yes.
And something that we could do something about to actually improve their quality of life.
Right, and I find that we get a lot of feedback from people who suffer with heavy periods, and part of the challenge is that what is a heavy period? How do you know what might be heavy for one person is not necessarily for another? Or because periods also change and develop as you get older. You can start off having one kind of experience of a period being quite light, and then as you get older it could suddenly get much heavier, for example, and suddenly you think you're dying, and you know, what are you going to do? So have you got any, you must have loads of experience of people suffering from heavy periods, and the challenges that particular issue brings to those people, because we find a lot of anxiety is caught up particularly with people who do have heavy periods.
Yeah, absolutely. Well, I think the first thing to sort of say is that all the textbooks say that having more than 80 mils of blood per period is a heavy period, but what does 80 mils mean? I mean, how can anybody quantify that? No one puts it in a jug, do they?
Yeah.
And so then if you look at other texts, they will, for example, say changing pads or tampons because they are soaked more than every 2 hours. But again, that really depends.
That's much more helpful than milligrams of blood,
exactly.
Let's face it, or teaspoons or whatever they say.
Yeah, exactly.
Yeah.
And also because a little bit of blood can go a long way.
Yeah.
So one of the things that we are as part of our training is you tend to get these kind of great scenario teachings, and they basically get a bed sheet and dump some red fluid onto it, and they say, how much blood do you think this is?
Right.
And you always think it's more than it is. So it's really difficult for us sometimes to quantify the amount of blood, but I think really is it too heavy that you cannot cope with it?
Yes.
Or has it become a lot heavier and it's not what you're used to?
Mm-hmm.
So, for example, if you're having heavy periods that are stopping you from going to work, being able to go to school, going out for social occasions, or do you think that they're making you feel really tired? A lot of people say when their periods are really heavy, they get kind of like aches and pains, especially like in their thighs.
Yeah.
So that can be another sign that maybe something's not right. You feel a bit dizzy.
I also feel extraordinarily tired. Those kind of day 1, day 2. Which is a new phenomenon for me personally as I've got older. But yeah, I really noticed that complete, I could almost fall asleep standing up kind of thing. And I think that also you need to potentially get your iron levels checked if you are having heavy periods and things like that.
Exactly. And I mean, the thing is that I think sometimes there's a bit of this attitude that, I just need to kind of like man up or woman up, whichever you like to subscribe to. But I think that really, over the last few years, I've noticed that a lot of women have become quite out of tune with listening to their bodies, and I think it's something that we really need to get back into, is that your body is trying to tell you something. You're not just being weak. You know, if you have a symptom going on, you need to think about, why is it happening? Is it something you can deal with? And then do you need to go and speak to your GP about it?
I mean, I must admit, I've over the last year or so been using one of those period app things, just because I was beginning to feel like I wasn't remembering each period and what it was like and things like that, and I wanted to monitor that a bit more, and I think that's been really helpful for me. Have you found that more people are doing that so that they can keep track of what the reality is? Because it's always hard to then remember 3 months ago, what was that period like? I'm sure it wasn't great or whatever.
I think it's really important for busy women. First off, for many reasons. So it's something I've started doing over the last sort of year and a half, and it's actually been really interesting because I always thought that I had maybe a 27, 28 day cycle, but I realised that's actually not the case because I'm just so busy and I don't really realise. So for me, it's been really insightful. I noticed a lot of my patients are doing it now because a standard question is, when was your last period? They whip out their phone, open the app, like, okay, that was when. It's very helpful for me. But also, I think it's a really good way of kind of looking back and seeing, what else might have been going on. Because I always tell patients that your period is a product of what's been going on for the last month in your body.
Right.
Because there are so many things to do with our lifestyle that can affect it. And sometimes, even maybe the last 2 or 3 months. Like, for example, did you have a horrible case of flu, for example? Or did you go on a work trip? Did you go on a holiday and you came back and you had terrible jet lag?
Right.
Or, did you have a deadline and you were maybe not eating as well as you normally would? You weren't sleeping very much. These are all things that can affect your period, and I think that if you're tracking it, you can gain a lot more insight into what's going on in your body, and maybe start to look at some of the...
That's very interesting, and it also goes
it.
back to what you were saying, that it's an overused word coming up. Holistic kind of approach has almost gone out the window. It's not listening to the body anymore so much, it's just moving on really kind of quickly from one thing to the next, and not really paying attention to what's actually happening.
Yeah, absolutely. And I think that that's one of the most overlooked aspects of women's health these days, is that we don't really necessarily have so much insight into what we do with our daily lives and how that affects our periods. So, you know, we always just, everyone knows that it's due to your hormones, but then, you know, the hormones are circulating your bloodstream, there's lots of other things that could be impacting that. It's not just literally the lining of your womb coming away every month. There's many, many more complex things that are impacting that. Yeah, so I always talk to my patients about lifestyle, and I would say about 80% of them are a little bit surprised that I'm asking them those questions. But by the end of the consultation, they kind of realise why I'm asking them, and I do like to try and give lots of kind of lifestyle advice, which can actually be really, really helpful.
Now, one thing that may or may not have be kind of lifestyle influence so much is endometriosis, which I've been on some courses that were put on by the fabulous charity, the Wellbeing of Women charity, which does incredible work into all women's gynecological health. Absolutely amazing, and they did a seminar on endometriosis, and I was completely enlightened, but in a really horrible way, because I had no idea how hideously awful it is for sufferers. Absolutely life-changing. What advice can you give anyone who is suffering on that level with their periods?
Okay. Well, so endometriosis is a disease where the lining of the womb, or cells sort of from the endometrium, can grow outside of the womb. So they might grow inside the pelvis, inside this abdominal cavity, on your ovaries, on your fallopian tubes, and also on your bladder and your bowel. So it tends to cause very, very painful periods, but also if it's growing, for example, on your bladder or bowel, it will cause pain when you go to the toilet, when you're urinating, or when you're having your bowels open. It causes terrible pain during intercourse as well, because it can basically cause scarring inside, things get quite stuck. There's kind of two theories as to how it comes about. So the first theory is that the endometrial tissue is already in those abnormal places in the fetus, so when you're in the womb, right from the start. But certainly one of the other theories is something called retrograde menstruation, which is where you have a very heavy period. The blood cannot get out through the vagina quick enough, so it goes back up the fallopian tubes and then into the pelvic cavity.
Right.
Because obviously the tubes are open at both ends, because that's how the eggs get in when you get pregnant. So it is linked with heavy periods, and that may be one of the reasons why people get endometriosis. So it is a really, really awful disease. If you have very, very heavy, painful periods, it's worth going to your GP, because you may need to be referred to see us in the gynecology department in the hospital.
And really push for that, because one of the things that came out from the conference at Wellbeing of Women was that on average it took something like 10 GP visits before you were listened to, and before you actually could be seen by somebody who was going to take you seriously. So push is my advice, and hopefully backed up by you.
I agree
in terms
with you.
of getting in front of someone who really takes it seriously.
Yeah, and I think that's another reason why we need to educate women better, because it takes a lot of confidence to be able to go and tell a doctor who's saying there's nothing wrong with you that there is something wrong. And so that's again why I really think we need to educate people about what's normal, because you sometimes really need to sort of advocate for yourself. So definitely.
Have you, I was going to ask about obviously toxic shock syndrome was very kind of the big deal in the 80s. Seems to have kind of fallen away as an issue, but then from time to time kind of crops up. That's when well, you can probably explain it better than me, but in my kind of mind, it's when you're leaving not just tampons, anything that's inserted in the vagina for too long, and you have then the possibility of getting toxic shock syndrome.
Yeah.
Is that true, or is it just to do with tampons only?
No, it's due to anything that you put in there, basically. What toxic shock syndrome is basically caused by a particular bacteria that secretes a toxin, and it makes this huge systemic inflammatory response in the body, and it can be fatal. It's quite rare, but it does tend to be associated with using tampons. And often when they've been left in too long, because the bacteria can then grow and you get enough bacteria then that it starts to cause a problem.
Right.
I have seen a couple of case studies actually published recently where it has been caused by using menstrual cups.
Yeah.
But certainly one of the issues that's coming out a lot in the press these days is about people who cannot afford tampons or pads and using really quite shocking substitutes. I've heard of people using socks, newspapers, and all of these things are not meant to go up there, and of course they're not clean in the way that a tampon is, and so then I think that you're really running a higher risk.
Right. Yeah. No, that's a really valuable piece of information. So I think the message there is to whatever you're using, I mean, hopefully you're not using anything other than actual sanitary products, and there are places where you can seek help to get free products from in your local communities and things like that, and there's a big push politically to get free sanitary towels into schools if you're on free school meals, which we are hugely supportive of. So there are moves afoot to change all that, but bottom line, please try and use actual sanitary products, whatever they may be, and change them frequently to avoid any possibility of that.
I think also it's about how you use them as well, because I've heard quite a few shocking stories, even from my friends. So for example, if this is quite a small tampon, if this is the tampon that you need to use, and so you should be changing them every 6 to 8 hours, so maybe in a day you need 3 or 4 of these, okay, but then you have a really busy day and you're rushing around and you think, I'm going to use this one and just keep it in all day. I've heard of people doing that. And that's
going
really
extra
dangerous.
big in order to not bother to change it.
Absolutely. And I also have a friend who shall remain anonymous, but has a real problem with having very irregular periods, and when they start they're very, very heavy.
Right.
So on her wedding day she actually used one of these huge tampons even though she wasn't bleeding, and I was horrified when I found out.
Just in case, you mean?
Absolutely. So it's, if you are somebody who has irregular bleeding, I mean that's obviously an extreme example, but if you're someone who has irregular bleeding, you shouldn't be putting tampons in if you're not bleeding, because that is quite dangerous.
Sounds much better to use a pad in those scenarios, just in case.
Absolutely. Yeah. Exactly.
Great advice. Thank you very much. So obviously we're both on the same page that there is a taboo, ridiculous taboo out there regarding periods and talking about periods and sanitary towels and tampons, etc. Are there any kind of cases that come to mind where this has been really highlighted for you?
Yeah, absolutely. I mean, I've seen some really quite shocking and horrific tales, unfortunately, in this country, in London. Wow. So I work in a central London hospital, and I had a case a few months ago where I was believed to go to the A&E department, and the nurse sounded very, very worried on the phone, and she said, can you please come straight away? I really need you to see this lady. She's bleeding very heavily. So obviously my first question was, is she pregnant? Because any woman who's bleeding heavily, we tend to worry, are they having a miscarriage? Yeah. She said, no, she's not pregnant, but her hemoglobin is 4. And I said, I'm sorry, 4? And
what does
so
4 mean?
A healthy woman should have a hemoglobin of about 11.5. So we're talking about a third of what it should be. And I said, well, what's her pulse rate? And she said, it's 107. And I said, right, take her to the resuscitation department. I'm coming now, but if she doesn't have a very big IV access, please put one in, and please get one of your doctors to start some fluids on her. So I ran down to the A&E department, and I walked in, and actually the patient looked quite calm. She looked a bit clammy, but the nurse just looked very, very worried.
Yeah.
So I just sort of started asking her what was happening, and she said, my period started today, and it's just a bit heavier than normal. And I said, okay, well, how many pads are you changing per hour? That's a question that we tend to ask to quantify the amount of blood. And she said, pads? No. I'm not using pads. I tend to take the first day or two off work because it's too heavy for pads, so I sit at home on folded bath towels and bleed. And so I thought, okay. And then she said, but today it was actually heavier than that. So I've just been in the shower with the water running and just kind of letting everything come out. But I felt really unwell, and I think I might have actually fainted. So I decided to call an ambulance. So it's just really, really shocking that would happen. So obviously I started the initial management, and then as things were getting a bit more under control, I just sort of said to her, without trying to be patronising, I just said, can I just ask you, why have you not come and seen someone about this before?
Yeah.
And sorry, I forgot to mention that she's 41 years old, and she told me this has actually been going on for 20 years. And yeah, so I said, why have you not come?
I'm kind of shocked she's able to function, frankly.
Well, basically the reason her haemoglobin's 4 is because she's been slowly losing iron at the speed of sound every month for the last 20 years. God. And I'm quite surprised that she actually managed to get this far. I mean, the woman must eat a lot of iron in her diet. She must have a fantastic diet. Exactly. But she basically said, I just thought this was normal. She'd had it from the age of 20. She thought it was normal. Then for the last few years, she said that she kind of started to think maybe it wasn't normal, and then was too afraid to ask any friends or family and too embarrassed to go and see her doctor. And that's obviously a very extreme example, but it's not an isolated case.
It's an extreme example regarding her experience, but the example of it being a taboo subject is not sadly extreme at all.
No,
and
exactly.
There is a case where if there was not a taboo, then that woman would have literally sought help 20 years ago.
Exactly.
And her life would have been very different during that time. Poor lady.
I know.
Well, thank goodness you kind of educated her, and hopefully now she's kind of managing it differently.
Yeah, absolutely. Yeah, it's a
Goodness
terrible
me.
story.
Well, we have all kinds of kind of not terrible stories like that, but definitely disposal nightmare stories, which again, going back to the taboo, people once I meet someone and I can't help myself but start talking periods and tampons, kind of like a crazy person.
Kind of like me.
Yeah, we should never go to the same party.
No, absolutely not.
So, but what I find is that they then kind of offload their kind of nightmare period scenario that might have happened last week, or it might probably have happened 10 years ago, and they've never ever told anybody. They've never kind of confessed this awful thing that happened when they were kind of trying to dispose of a used product and in an awkward situation, and the kind of horror of it, and they feel it's quite a cathartic thing. They feel really relieved once they've kind of told someone. They say, I've never told anyone that, and I've just met you. And it's like, yeah, well, that's because the taboo stopped you from having that relaxed conversation, or even like a giggle about it, because if enough time has passed, then actually even the most horror stories can end up being quite funny in hindsight.
Yeah, but I think that the relief that people get from telling you those stories just actually shows how much anxiety all this problem causes. Yeah, it's shocking.
And I think in some extreme cases as well, it can be a situation where the anxiety moves away from anything remotely funny and can end up being really stressful and difficult for mental health situations, particularly in young teenagers who are kind of in a natural state of anxiety often anyway.
Yeah, absolutely. Yeah, so I actually spend a lot of time seeing very young, healthy women. So I do a lot of colposcopy clinics, so that's where people come when they have an abnormal smear. So it's anybody from the age of 25 upwards, but also younger women if they have abnormal bleeding. And so that's actually one of my favourite clinics, because I just love the opportunity to really just have a good chat. And I think that because I look quite young. They, and I have quite a casual sort of approach with those kind of patients. I've really had some fascinating conversations, and I've had so many of them walk out the door saying, "Wow, I never knew that. That's amazing. Thank you." And they're like, "Oh, I'm going to tell all my friends."
Yeah.
And I think, okay, that's good. It's all filtering down somehow.
It is.
So it's just sort of how
you're doing great work when you're kind of getting through to people on that basis, that they kind of have a sigh of relief and just kind of think, "Oh, this is fine. I can talk about this, or I'm gonna bring it up on my next girly night."
Exactly. I think one of the big problems though as well is that when you Google this kind of thing, I mean, you're basically diagnosed with cancer, aren't you?
Yes.
So one thing I would say is that heavy periods are a real anxiety to people, and everyone thinks that it's cancer. If you have a premenopausal woman, so a woman who hasn't gone through the menopause, who's having very, very heavy periods, only about 0.3% would actually have heavy bleeding because they have an underlying cancer.
That's really a useful stat.
It's very, very, very small numbers.
Yeah. Doesn't mean to say ignore it or just accept it, but that's reassuring, hopefully, to a lot of people.
Yeah.
Yeah, brilliant. One thing about this whole taboo, I think, is that in order to really break it down fundamentally, we have to involve men and boys into this conversation. Hopefully the younger the better. Because I think keeping them at arm's length is not doing anybody any favours. They are involved, even though it's on the periphery, because they can be very supportive and understanding and practically helpful at times if they understand what's going on, and they can get over their own embarrassment about it and become just knowledgeable and normalise it. This having periods is normal. We need to normalise the whole process, the discussion, the practicality around it, and then the taboo is dead. So we're quite passionate about working with men, talking to men, bringing them into the conversation, showing them, what this is. You show most men, they think it's a sweetie, and I kind of don't blame them. But I think that they need to understand how tampons work, what the idea is, the difference between them and pads, why people would choose one over the other, what a moon cup is, that kind of thing. So I don't know if you agree, but I think that getting that message over is really important.
I definitely agree. I mean, let's be honest, the reason we're all here is because of a period, or the lack of one.
Yeah.
Yes. And I certainly remember when I was at school, I went to a fairly traditional comprehensive school in the late 90s, and I remember being taught about periods. The boys were taken out of the room and it was just the girls. And clearly this education was so inefficient that I actually thought that a period was when your egg came down the fallopian tube and cracked, and that was the content coming out. Okay, this is someone who is now a gynaecologist, and I've always wanted to be a doctor, so I'd like to think I was a bit more switched on than other people, and honestly, hand on heart, that is what I thought a period was for quite a long time.
Yeah.
So
if that's what you thought, what did the guy next door think who chucked out of that lesson altogether?
Exactly.
Yeah.
So I don't know when all the boys that I went to school with found out about periods. Maybe I should ask a few of them, but
most men, boys, whatever, will have, obviously they have a mother, they might have a sister, they will maybe have a girlfriend, they will have a friend who is a girl. They were going to come into contact with periods. We did do a great interview with a fab guy called Non-Perfect Dad, and we were talking about all this stuff, and he was saying that actually one of the key things he loved about FabLittleBag was that it was a real icebreaker for the male community, because they could kind of give something period related to their daughter in particular in this case, and in itself that was kind of saying, look, I know about periods, I understand that it's going on, and I'm thinking about how I can maybe help, and it just communicates all that message in one kind of simple action, and hopefully helps to break that ice between father and daughter.
Yeah, definitely.
So if we can start it at that level, it's got to be a good thing. Right?
Exactly, that's just so important, and I think we forget that not everybody has a mum at home. There's a lot of single dads out there. who I think need help in trying to talk about these kind of things. And to be honest with you, I even get a lot of women asking me, how can I bring up reproductive health, periods, sex and things with my daughter? So if women aren't able to,
it's not the case that all women are totally relaxed and casual about talking about periods at all.
Exactly.
I mean, hopefully, the younger each generation becomes more so, but it's certainly not the case. Not the case now.
Exactly.
And what about kind of going back to kind of leaving things in too long?
Yeah.
What kind of interaction have you had about the concerns that people have? Why would they do that?
I think quite often it might be embarrassment. So, for example, you work in an office, your handbag's next to your desk. Are you going to put your hand in and then kind of like shove it in your...
Or the sleeve smuggle, yes,
all that kind of thing.
Sleeve smuggle.
So I think that can be a tempting reason, or why are you taking your handbag to the toilet? That it just kind of like it flags up like, hey, I'm having my period, that kind of thing. I think that's one. So
you could just wait until lunch or home time or something like that.
Or if you're out and about, and like for example, like I think I'm pretty good now. I know on Oxford Street which shops have good toilets, and so it's just kind of like, do you know that there's going to be a toilet where you're going?
Yeah.
But then also, is there anywhere to dispose of them? You go in lots of kind of really nice, pretty bathrooms all over the place, and lots of them don't have a proper bin to dispose of your sanitary.
Well, they have got those horrible sanitary bins with like bits of someone else's tampon poking out, or the sanitary towel still nicely stuck to the inside. Yeah, those are just they're just horrible.
Exactly.
They're just horrible. Well, you can FabLittleBag it, and you don't need to touch those things anymore. It's wonderful.
Exactly.
That's been so interesting, and I hope that you've learnt stuff that reassures you and educates you and helps you feel like you're a little bit more knowledgeable and in control of your periods. And I really want to give great thanks to you, Anita. It's been fabulous, really fabulous. And we'll have you again and talk about other things too.
Definitely.